This is Vet Tales, the story of the Sailing Veterinary Clinic. Last episode, we visited the fifth and final village in the San Jose Channel. This episode, we have the first ever Spay and Neuter clinic in Agua Verde. So it's the morning before the Spay and Neuter campaign. We're going to head into shore and see if we can check out where we're having it, just so we kind of have an idea of space and what we need to bring. Confirm, we texted Sia last night, just confirm she's all on target for coming on Saturday. And we also have to stop by a few boats. One, because some people are going to be volunteering with us at the campaign, which will be really cool. And then also, one of the cruiser's dogs got bitten by a rattlesnake 2 days ago. She's doing well considering. He was really worried about it, but he was even further out and started heading up towards Loreto in the hope of getting to a vet. But thankfully the next morning she was doing really well and he was like, okay, I can maybe slow down. And yeah, she's doing good, but has got quite a swollen leg where she's been bitten. So we're going to look at just giving her a check over and probably starting some medicine to make sure it doesn't get any worse. Yeah, it's kind of funny actually. He was heading towards Loreto to get to the vet just in case. And then when he came here to stop the night, one of the cruisers was like, oh, the vet boat's actually going to be here tomorrow. So he knew we were coming. So yeah, it was kind of funny, like small world. Word is spreading about Chuffed and the veterinary clinics.
This is how she acts with the I think I got it. Because she
All right, as you can see, Patty is doing pretty well. She's obviously in a bit of pain though, which is understandable. It's quite swollen. So we've got her on some antibiotics and some anti-inflammatories just to get rid of the swelling and to also stop the wound getting necrotic, because snake bites can get nasty wound breakdown afterwards. But yeah, she's doing good. Interestingly, it sounds like the snakes on the island, Will, her owner, did a little bit of research about it, and it looks like the snakes that live on some of these islands are actually a subspecies of rattlesnake that are not as toxically venomous as some of the mainland ones. So she probably got very lucky that the subspecies she was bitten by was one of the least venomous of all the venomous snakes. Still not great, but yeah, she's doing good, so that's good news.
Ellos 2 días tienen el yesterday como el damos que.
It's nice and cool here, which is great. We've only got this little area for maybe recoveries, then the surgery area. Yeah. So I'm going to start prepping all of my surgical gear and veterinary gear. There's actually like a lot to bring. So although Dacia and her veterinary friend Maria are both coming, or both meant to be coming tomorrow, we have to prepare as if they may not make it here for some reason or another. So I'm basically making sure I have all the equipment I need to be able to do surgeries. But I'm also kind of like making sure that we have equipment for, like, because it's so easy to forget something, right? Like, you know, you forget the scrub for the animal skin and for the equipment and for your hands. I have that. So basically we're going to be bringing our stuff, extra stuff, and then some. So it's a lot to prep. We're basically prepping an entire surgical suite for like 3 veterinarians and 40 animals in their little boat. So right now I'm cutting up drapes. So I like to use drapes on the wounds when I'm doing surgery. Not all vets here do that. I like to do it. And I also am prepping to be able to autoclave, well, pressure cook, 3 sets of surgical instruments so that I've got sterile instruments to start the day with, and then we'll be disinfecting them throughout the day. Yeah. So for now, I'm making some scrubs. So this is where I do my little operation, pull the guts out, put them back in. There's a lot to think about. It's like alcohol for disinfectant, trays to put disinfected items in, and scrub material for the animals, stuff for cleaning instruments, swabs, sterile drapes, hand washing towels, more gauze, gloves, powder for my gloves. And I haven't even started on the medications, suture material, scales. Yeah, there's still a long list. Extension cords, yeah. The list goes on. I will pretend throw that in just in case we need to put in a drip. The animal pressure cooker. Clearly not the one we use for food. All that pressure cooking ran out of gas. So Jim's,
it's the most fun job on the boat.
Yeah, as you can see, he has heaps of space. The gas is conveniently located in this easy to access locker. All done. Most fun you've ever had?
Highlight of my day. So what's the verdict?
Sia answered my call. She's coming. Got all the materials. She's packing it all up. Should be here hopefully by 9. And she'd like to finish at 4 so that they're not driving back in the crazy dark on these roads. So yeah. Hopefully we fit in the dinghy, eh?
I think we'll do it.
We're heading in for the Spay and Neuter campaign. We're bringing our handheld radio because that's how we're going to coordinate with the cruisers, because we don't have cell service here and Wi-Fi is kind of patchy throughout the restaurants. But I think we have everything. And Desia's bringing even more. You need a lot of stuff to spay and neuter like 30, 40 animals. And we're off. She's low down, isn't she?
Yeah.
Poor old Belafontaine. Our needs were pretty basic at our makeshift surgical clinic. We had to have shade, tables, electricity and water. Everything else we brought with us, including medicines, anesthetic, surgical equipment and disinfectants. The first patients started arriving almost right away. Although this was primarily a spay and neuter campaign, we also had dogs and cats coming that needed vaccinations or medical care. Grenya was one such dog. He had a severe ear infection and matted fur. We gave him an initial check over and did some basic treatments for his ears, but quickly realised he was going to need a longer consultation. We organised a visit with him and the other longer treatments the next day, focusing on quick medical consults like vaccinations and prioritising our surgeries while we had the veterinary team. So we've seen a couple of patients this morning already for other things like ear problems, and then just did a vaccine, and then we're going to start surgeries. I think Desia's already getting started. We had quite the crew for our campaign. Cruisers from 3 different boats were helping with admissions, surgical preparation and recovery. We also had a veterinary team from Loreto focusing on surgeries, Jim filming, and our local contact Joel helping us to coordinate everybody. We had multiple stations set up with different people taking charge of each area. Sam and Michael were admitting patients, getting important information like age, weight and owner details. And then one of the veterinary team members would give the anaesthetic injection. Once the patient was asleep, Sam and Michael would shave the surgical site and clean it to make the area sterile, all of which was on-the-job training. The patient would then be moved to surgery, where the veterinary team would keep them safely anaesthetised and do the castration or spay. They'd then get their post-operative medication before being moved to Heidi, Aaron and Justine, who were monitoring patients during their recovery. Once they were swallowing normally and able to sit up, they'd get a final veterinary check before going home.
Put her in the water. She doesn't get that terrified look anymore.
Está bien, mi amor. Mira. Ya, listo. En como 5 minutos pasa. Yes, we did tell them 5 months, so she might just be here for vaccinations.
Did you do this guy yet? You have to write an article. Okay, I wrote
A magazine called Latitude and Attitude. It's about losing every now and then. Yeah, just you know, I mean, they love the story, and you should write one.
I don't think my English writing is too good.
No.
We do need the way.
Yeah, we do.
I know, with all this AI out there and everything.
We often have to get inventive doing clinics like this. Since we had no walls or doors, we were keeping our cat patients in crates to prevent any escapees. We use a really low dose for them, but he's starting to come a little bit. As you can see, these clinics get busy and chaotic, with lots of people and pets all in one area. But there is a lot of organisation and control amongst the chaos. Everybody had their workstation and jobs to do, while also allowing the flexibility needed in this environment. I was acting as the floater veterinarian. This means I'd see the consultations, okay animals for discharge, talk to owners, coordinate with volunteers and also do surgeries in between. This allowed Decia and Maria to keep cranking out surgeries while I ensured all of our patients were getting the best of care. For Veya here, she's cute, and some parasite medicine. No, Veya, está bien. Although this isn't your typical clinic, we all pride ourselves on providing high-quality veterinary care, keeping surgical areas clean, giving pain relief, monitoring patients closely, and providing any additional treatments they might need. A really important part of keeping our patients safe is ensuring they're well cared for in the lead up to surgery and afterwards as well. We had vaccinated and provided parasite control medicine to all of these patients a month previously, to get their health on track for surgery. Joel also provided all of the owners with instructions not to feed the animal the morning of the surgery, and I then spent a lot of time giving discharge instructions. Important information like keeping pets quiet and indoors after surgery, talking about post-operative complications we need to look out for, and when the pets can have access to food and water again. We also had a WhatsApp group with these instructions written out and to allow owners to contact us if they were worried about anything after surgery. The spay and neuter clinics we did in Puerto Madero all those years ago with Dr. Baracuel really helped prepare us for this moment. He used to always give multiple lectures throughout the day to owners, instructing them on how to take care of their pets properly. And I found this to be a really great way to spread the word.
Adiós.
Adiós.
Adiós,
You, pobrecito. He's only 4 months old. Normally we wait till they're a little bigger, but he had an umbilical hernia, which means his intestines can slip out of the hernia and twist, which is quite dangerous and can be life-threatening. So we decided, since it might be a little while before we're back doing a spay and neuter campaign here, that it was better to do him now and not have that happen. Hey, my darling. We'd like to say a huge thank you to our donors and patrons who made funding this project possible. And a special thank you to Dacia, Maria and the Loreto Vet team, and all of our volunteers who made this campaign run so smoothly and so well. This project was months in the making and was the culmination of 4 visits to Agua Verde, many supporters, and enthusiasm from the local community. Without all of these things, it wouldn't have been such a big success. Alright, so we're just wrapping up our surgery day. We've had around 30 animals come today, which is a really good turnout. Mix of dogs, cats, males, females. Everyone's worked very hard. Our 2 veterinarians from Loreto have done lots of surgeries, as have I. We've had volunteers helping us, people working on anesthetics, taking names of animals, weighing them, shaving them, cleaning them, waking them up, doing medications. It's been a big day. So I want to say a big thank you to everybody who volunteered today, but also a big thank you to everybody who donated to make this campaign possible. We couldn't do it without you all. It was very much a team effort, and also very grateful to the community here for letting us work here, and Joel and his family really got everybody organised. Joel's been running back and forwards all day to the restaurant where they have Wi-Fi to text people to tell them when their appointment's coming up, so we don't have too many animals or not enough animals. So yeah, it's been a chaotic but very good day, and all ran very smoothly. All the animals have done really well with their anesthetics and are recovering well. And as of right now, we just have this one little girl dog left. We may have 1 or 2 more cats coming, but they also may have run away, 2 male cats. So maybe they come, but if not, we'll get them next time. Yeah, really good day all in all.
Is there like a little...
You might notice the birds pooped on our dinghy while we were doing our campaign. Heading back to Chuffed. We're pretty tired, but good day.
Are you tired?
Oh my god, I'm really tired. I was just saying, we were trying to talk. We met some people on the beach as we were leaving. They gave us actually a really nice tostada with ceviche each. And I was trying to speak, I can't even speak English. I was trying to speak Spanish and I was like, I can barely speak. Anyway, I'm gonna jump in the water. Let's do it. There's fishies.
Ouch.
Do you think it's gonna be cold or do you think it'll be lovely?
I think it's gonna be pretty nice.
Okay, at least go for it. 2, 3. Oh, it's so good. Ah. That's nice. Thank you all for watching, and we hope you enjoyed what we expect to be the first of many spay campaigns in this area. You can help fund projects like this one by becoming a patron or making a once-off donation on our website. We are so proud of the help we were able to provide to this community and couldn't have done it without all of you. Until next time, stay chuffed, everybody.